No one is more charming and entertaining than Alberto, also in terms of having founded this organization and supported us all these years. And it brings back memories of having had our first office in the semi-interato place with the European School of Oncology, and the fact that the school also provided all of this space until we could become independent, raise enough money in order to become an independent organization. What I'm going to do is to talk briefly about the highlights of the last 25 years. There's going to be a lot of material on these slides, and I'm not going to read it all, but at least in the end, if you want it afterwards, you'll have a bit of an historical picture of what it has been and what it has taken to become Europe's Breast Cancer Advocacy Organization, to establish ourselves as Europe's Breast Cancer Advocacy Organization, which is really the challenge that we were faced with when I was hired in 1998. And I'm going to mention Gloria Freilich again, too, as our founding president. She actually hired me, and she has sent us a message which I'm going to read to all of you from the UK. She says, "Dear Europa Donna members, staff, and distinguished guests, may I add my welcome, albeit from a distance, to all of you for our 4th Pan-European Conference. As some of you will know, Vienna has a particular place in my memory as the city where I was formally elected president of Europa Donna for the first time all those years ago. I do so wish that I could be with you today as we celebrate an incredible 25 years of European breast cancer advocacy, along with all the progress achieved in that period. May our cause continue to go forward from strength to strength, and I wish you a memorable, inspirational meeting." So with that, I want to mention that she was the first of 10 presidents that have led our boards over the last 25 years. And as we moved forward, establishing Europa Donna as Europe's breast cancer advocacy organization involved a great many activities that mostly involved establishing ourselves as the organization that would provide evidence-based education, information, and policy to women across all the countries and at the European level. Of course, that meant the most important thing, first of all, was getting more members in more countries. We started with about 12 in 1998, and we're 47 today. So that means we have now established ourselves as representing many, many women across many countries in Europe. The partnership for EBCC1 with the EORTC and USOMA was one of the most important partnerships that we established, and it has continued until today, so that we, as a patient advocacy organization, are equal partners with scientists in providing one of the most important scientific breast cancer meetings that takes place every other year in Europe. The first meeting at the European Parliament also was a very important milestone in 2001. At that first EBCC, Europa Donna was called upon to address the European Parliament, and we succeeded in doing that at this 2001 meeting, and we were the first group in any disease category to do so at the European Parliament. That led to the formation of a European Parliamentary Group and our work with that group to draft the first Parliament resolution on breast cancer that was passed by the Parliament in 2003. In 2004, we began our research engagement with BIG, the Breast International Group, with many of us serving on the steering committee and other committees of the MIND Act trial. And that led us to many other research projects over the years, which we'll talk about later. And then at that point, we had about 38 member countries. So we were growing strong in terms of numbers of countries represented in the coalition. In 2006, we worked again with members of the Parliament to pass the second Parliament resolution on breast cancer, and we worked on the 4th edition of the EU guidelines with the various experts from the Breast Cancer Network. And that led us to publish the Europa Donna Short Guide to the Guidelines, which became a very important booklet translated into 17 languages to explain to parliamentarians, to the lay public, to other women, the services they should have a right to receive in their countries, primarily mammography screening, population-based mammography screening according to guidelines, and to be treated and to have access to care and specialist breast units set up according to guidelines. So this was very important in terms of establishing the policies that all of our countries would work to get implemented across their countries. In 2009, we were fortunate the Boston Consulting Group, on a pro bono basis, helped us work on our first Europa Donna strategic plan. In 2010, we worked with parliamentarians to get a written declaration on breast cancer passed in the EU, again, establishing the same concepts that we still need specialist breast units to get implemented in all of our countries, and we still need population-based mammography screening in all of our countries. A lot of progress has been made, but we still weren't there. And so then we were 46 member countries strong, and that meant that a lot more women were getting involved in trying to get the same services implemented in their countries. This proceeded to us working in 2011 and 12 in meetings with the Joint Research Center in terms of getting an accreditation project protocol developed so that women could be sure in their countries of the kinds of services that they were getting. Were specialist breast units in one country really the same as specialist breast units in another? Well, we're still not sure, but we're working on this, and it's a major project to try to ensure a kind of quality assurance so that women can be assured that they're getting the same high-level service across all countries and all regions of all countries. So we worked with the JRC, and we continue to work with them today on the European Commission Initiative on Breast Cancer. We've also worked on the 2015 written declaration against breast cancer in the EU, because that then also called on the ECIBC to complete this project. It reiterated the need for specialist breast units set up according to guidelines. It reiterated the need for population-based mammography screening, but it added that women with metastatic breast cancer also need to have the right to have access to specialist breast units for all of their care and treatment, and that all of their needs should be also met by a specialist breast unit. So this was very important. And at that point in 2015, we arrived at 47 member countries, as we are today. We passed a resolution on our own constitution, and in 2017, having recognized the need and the needs that women with metastatic breast cancer have for special services and services that are not being provided today, we set up the first metastatic breast cancer conference, and we're doing that now every year because we recognize more and more that the needs of women with metastatic breast cancer are not being met. In 2018, we've continued the other projects. We've continued our advocacy leader projects. I think I forgot to mention that in 2008, we set up a prevention program called Breast Health Day, and that continues every year, as do all the other programs that I've mentioned and that are listed here, so that we continue these on a rolling basis through all of our years. 2018, we developed the Advocate's Guide to the European Commission Initiative on Breast Cancer. Again, this replaces the short guide that was published in 2006 because we have to begin to be sure that we're implementing the new guidelines and the new procedures that are being set up through this important program that the Commission has projected for us. So we now arrive at 2019 and the beginning of our third strategic plan, and our most recent meeting at the European Parliament, which again reconfirms and wants to reestablish the same needs and for service that we have in Europe, so that the new parliamentarians understand what those services are, what they should be, and they can help us fight for them. So, to summarize, there have been 19 advocacy training programs, 14 pan-European conferences, 5 advocacy leader conferences, a great many research programs in which we're now involved, a great deal of information that has been developed that's evidence-based that everyone can have access to, 2 EU resolutions, 2 EU written declarations, but above all, 47 member countries, 12 executive boards that have led us through the years, an independent head office for many years, 5 staff members, 3 strategic plans, 25 years of advocacy progress. And along the way, we have worked and still work and collaborate with every single organization in Europe that has anything to do with breast cancer. This has been very important in terms of a collaboration, in terms of being able to get the evidence-based information we need from the EURTC, from members of USOMA, from the IARC, from the EORTC, from the Breast International Group, and working with all the other patient organizations, and also with our 14 sponsors who support us with educational grants to provide all of these programs. We thank them as well. We've worked with all of these organizations. We will continue to work with all of them as we move forward for the next 25 years. But above all, it's all of you. It's the members of our 47 fora that make all of these services happen in your countries. It's the fact that we are a European advocacy organization with a European strategy and goals, along with an extensive network at the national level. All of you that are members of the Europa Donna fora in all of your countries, because it is you who are working at the grassroots level in order to get these services implemented, in order to get your governments and health systems to provide these services. And all in all, over the years, we've had a significant impact for this reason on both European institutions and improving national breast services. So with that, I would like to thank all of our members from the 47 member countries and say congratulations to all of us at Europa Donna for 25 years of progress.